I'm Dr. Cherith Semple, who's a reader in clinical cancer nursing. I'd like to present an overview of the qualitative evaluation of the patient-concerned inventory in the post-treatment management of people with head and neck cancer. This formed part of the evaluation process of a 3-year NIHR-funded study led by Professor Simon Rogers to investigate the use of the PCI in a clustered randomized control trial. This was across multiple consultants at 2 locations in the north of England to ascertain if the repeated inclusion of the PCI in routine head and neck consultations could make a difference in patient-reported quality of life. The head and neck cancer PCI is a condition-specific prompt list with 56 items covering 4 domains that allows patients to raise concerns that otherwise might be overlooked. Nested within this PCI trial was a qualitative component to explore the implementation of the PCI by head and neck consultants across 2 NHS organisations. 7 semi-structured interviews were carried out with consultants in the PCI arm of the trial, and these were aided by a topic guide. Interviews took place within the healthcare setting, were face-to-face, audio recorded, and lasted between 20 to 30 minutes. Audio recordings were transcribed verbatim. Data was analysed using Braun and Clark's thematic analysis framework by 2 experienced qualitative researchers, being Dr. Jeff Hanna and myself. Themes were verified and refined through discussions at team meetings. 3 overarching themes emerged. These were identified from the consultants' data in the PCI arm of the trial. We've got theme 1, enhancing the consultation, being an integral holistic dimension. Theme 2, utilization of the PCI in routine care. And theme 3, barriers and facilitators to implementation of the PCI. Let's have a little look closer at theme 1, which was enhancing the consultation. Findings highlighted that using the PCI prompted a shared understanding of the patient experience, especially surrounding emotional and psychosocial dimensions, with offer of advice or initiation of referral to emotional support services more readily. Use of the PCI also prompted and empowered patients to discuss sensitive topics, such as intimacy, sexuality, and fear of recurrence, which previously may have been considered irrelevant or not identified. We can see this is encapsulated in the second quotation on the screen from participant 6. The more sensitive things, I think it is good for that, because I suspect those things may well go unsaid or unasked. Moving on to theme 2, utilization of the PCI in routine care. For the head and neck consultants, the PCI proved not only easy to use, but it offered a flexible approach, which more often was driven by the needs of individual patients. Then, theme 3, what were the main facilitators to implementation of the PCI? Well, firstly, there was the minimal training that was required. For most consultants, a brief one-off session of less than 1 hour was adequate. Findings also highlighted that the use of the PCI did not elongate the consultation time, but it enabled clinicians to streamline their consultations by directing the focus towards prioritization of important items as indicated by the patient. We can see a further quotation on the screen, which is from participant 2, which is saying, I thought it would lengthen it, but that was my initial impression, but I don't think it has actually. If anything, as you get more comfortable, I think you cover more ground quicker. So in conclusion, the PCI can function as a trigger for patient issues, potentially allowing for more effective communication. Furthermore, minimal training is required to use the PCI in routine follow-up care, offering a more holistic consultation without lengthening the appointment time.